Hi, I'm Saul Simon, and this is Simon Says Manage Your Money. Welcome, as always. I invite you to take a piece of paper and a pen to take some notes and ask some questions. Today's program is on the graying of America. And with me today is my guest, Dr. Beverly Freelander, a doctor of cosmetic surgery in the area of plastic surgeon, right?
That's correct.
And you know, as Beverly and I had spoken and met and started speaking, I thought what an opportunity it would be to actually share some of her thoughts and insight, and maybe from her perspective, as to what she sees and what she's hearing as she's meeting people. We're all getting older. We're experiencing the normal ups and downs of life. And then we also started talking about the economy and the impact that that would have maybe on her business. So I said, why don't you come on the program to see what we can share with you, our viewers. So as always, I always welcome your feedback and your input. I love hearing your thoughts, which gives me the opportunity to then think as to who else would be a great guest to bring onto the program. So Beverly, thank you for coming on the program.
Well, thank you for inviting me. It's my pleasure to be here.
Yeah. So you've been a doctor in this field of cosmetic surgery for a number of years. I'm sure you've seen a lot of changes.
I have, yes.
Given what's happened in the economy, given what's happened in the world, has that affected you and your business?
Absolutely. I think it's affected everyone's business, and I think it's important in this business environment to maintain a certain degree of flexibility and to go with the flow, to follow the market trends and to be able to adjust your business practices to those trends. And in fact, that is what I've been doing.
Tell me how.
I am fortunate in being a member of the American Society of Aesthetic Plastic Surgeons, and my society maintains statistics on the changes that are occurring within the cosmetic industry in America. And what we have seen over the years is that over 50% of Americans approve of plastic surgery. Over 33% of Americans would consider having plastic surgery on themselves or have already had plastic surgery on themselves. Plastic surgery certainly is in the mainstream. And as a result of that, we are able to identify trends and to follow them. So that what I have seen over the last few years with the downturn in economy is that individuals are interested in maintaining their appearance because it improves their sense of well-being and their sense of confidence. But because expenditures are certainly an important consideration, what they're looking to do are procedures that are less invasive, ostensibly less costly, and yet are predictable in terms of their outcome. So that what we're seeing is an increased number of individuals who are interested in undergoing non-surgical means of cosmetic enhancement.
For example?
Things such as Botox or Dysport, which is a neuromodulator. And the use of the neuromodulators can significantly improve the appearance of the upper face. For example, it can soften the eyes, it can raise the eyebrows, make the eyes look less tired or fatigued or even less angry. And we're also seeing an increase in the use of fillers. And fillers are products which can be applied below the skin, which will plump it out and fill it out in such a way as to create much more youthful contours. And we're actually also seeing an increase in the number of procedures involving advanced technical applications, such as lasers. We're currently doing procedures for laser resurfacing and laser hair removal. And all of these have really been incorporated into my practice because this is what the public is demanding.
Does insurance cover any of these procedures?
I wish insurance did cover the procedures. For all intents and purposes, when a procedure is done for cosmetic purposes, it is not covered by the insurance carrier. The exceptions are very, very few and far between.
We're living longer. It's very possible today that if an individual is living at the age of, say, 60 or 65, it's very common or statistic that this person could live to age 90, 95 years old.
Absolutely.
And diet, exercise, and then overall well-being is very important. What impact have you seen with regards to the baby boomer coming in to see you to take care of their own well-being?
Well, one of the things that I've incorporated into my practice is the concept of age management. I discuss the importance of a four-letter word, diet, with all of my patients. I discuss the concept of exercising and also certain other concepts such as sun protection. And most importantly, although I think I'm seeing a little bit less of it today, we talk about the importance of cessation of smoking, because cigarette smoke can cause damage not only to the lungs, but also to the circulatory system. It causes premature aging of the skin, and it causes problems with healing. That being said, I do incorporate age management into my practice, and what I'm finding is that a lot of people actually are coming into my practice asking for gentle improvements, subtle improvements in their appearance. Patients today are very interested in maintaining a natural appearance. They don't want to look operated. They don't want to look tight or plastic. So that what we're seeing is someone coming in and asking for just a little tuck around the eyes, or something to make their appearance look less tired, or even asking about improvement in their frown lines. And that very frequently is the first step into the world of cosmetic surgery. It's a non-surgical enhancement, but as I said, it works beautifully. And because of the improvement that my patients are seeing, I think many of them, having taken that first step, are interested in undergoing further surgical enhancements.
Tell me what a consultation looks like.
What a consultation looks like.
So I come in and I say hi. And that's not the way we met, by the way, everybody. So I come in as a consultation. Mm-hmm. What do you try to accomplish? What is it you want to find out from me? Mm-hmm. What are my goals? Tell me what happens. What does this consultation look like?
Well, we start by finding out exactly the areas that you're interested in improving upon. So I'll ask you, Saul, can you tell me a little bit about yourself? What are the areas that bother you? What are the areas that you would like me to address? And then, of course, you would answer.
Yeah.
And we would speak a little bit about that, and then I would look at your medical history. I think it's very important to assess the individual as a whole and not assess them based upon the areas that they're looking to improve upon. So we'll go through your medical history, if you're taking any medications or if you've had any significant illnesses in the past, and we'll discuss how that might impact upon your recovery or upon the procedure that you're contemplating having performed. And then after we've completed that, I'll do a physical examination. And again, depending upon the nature of the procedure, we may just limit the examination to the region that we're addressing, for example, the face or the body, or we may perform a complete physical examination depending upon what, again, your needs are. And then we would talk about the specifics of what you are interested in pursuing. For example, in the male population, the statistics have shown that the 5 most common procedures are actually liposuction of the love handle, blepharoplasty or eyelid lift. Some men are looking for breast reduction because they have fullness located within their chest tissue, which they would like to improve upon to maintain more youthful contours. And in men, actually, rhinoplasty is one of the most common procedures that are being performed today.
What is rhinoplasty?
Rhinoplasty is actually nasal reshaping, and many men are looking for an improvement in the shape of their nose, and sometimes also that comes with an improvement in difficulties that they may have breathing.
Interesting. Interesting. How did you get into this business?
Well, that's an interesting question that I could spend hours upon hours talking about. I've always been intrigued by beauty, by both the art and the science of beauty. And I've always been excited by the changing within the seasons and the changes that occur within, for example, flowers or trees or the entire environment for that matter.
Pretty.
And in medical school, we were exposed to that very early on with the changes that occur within the life cycles. Birth to adolescence to young adulthood, middle age, and then finally older age. So I was drawn to the science of restoration. And of course, plastic surgery lends itself to that. So we began by trying to restore defects that had been created as a result of trauma or as a result of surgery. And the techniques that I learned doing that, I have been able to apply to restoring youthful contours and natural contours to the human body. And these are contours that are more in keeping with a lifestyle than in keeping with a given age, particularly considering the concept of the graying of America.
Right. That's great. That's great. You know, given when I speak with doctors, I have a number of doctors that are clients. And we very often talk about insurance because it pays the bills and it helps the people to have the services that they provide taken care of. You're not in an insurance business, and I would think you're in a cash business, relatively. Is managing a business difficult as a doctor today?
I think managing a business is difficult within any profession, unless, of course, you have an MBA or finance as your area of interest.
But even if then you have that, it's still
We have the
challenging.
hassles. That is very, very true.
Yeah.
In medical school, we were never taught about the concepts of business management. Most of us went into medicine for altruistic reasons. And we found that when we entered into medical practice that we were unprepared for the responsibilities of paying the rent, dealing with salaries, dealing with human resources, paying our loans, et cetera. And it was an education in and of itself. And I think most physicians learn early on how to be efficient and how to manage a business. The managing of a business is very much a part of medicine today.
Clearly.
Yeah.
People don't realize that you weren't taught this information, you weren't taught this material in the area of management. And very often we're taking more time managing our business than we are doing what our passion has in store. So excuse me one second. We're going to take a break and keep stay tuned, and we'll be right back. Thanks.
Ladies and gentlemen, this is your captain speaking. We've been cleared for takeoff to beautiful Hawaii. We'll be flying at an altitude of, sorry, we seem to have forgotten the flight plan. Guess we'll just have to wing it. Anyway, sit back and enjoy your flight to beautiful Hawaii, or wherever.
Don't let a lack of planning keep you from reaching your dreams. Visit the Nonprofit Financial Planning Association today at plannersearch.org.
Hi, welcome back, and thanks for joining us. I'm Saul Simon, and this is Simon Says Manage Your Money. Today's guest is Dr. Beverly Freelander from Short Hills, New Jersey. And I just, again, want to thank you for sharing your thoughts with us. You know, something personal recently that happened to me is a girlfriend of mine in town. She and her sister was diagnosed with a gene to acknowledge that she has breast cancer. But she didn't have breast cancer, but she had a gene that determined that she could have breast cancer.
Yes.
Okay. So as you can see, I'm not really clear how I'm speaking it, but I'm glad that as a doctor you understand what I'm saying. So she and her sister actually were proactive to have a double mastectomy. And I'm friendly enough with her, through her husband and I, to actually inquire and ask the question how courageous and how bold she was, and her sister, to go ahead and seek the assistance of a professional like yourself to alleviate the problem, hopefully, and then do reconstructive surgery and take care of her well-being. Do you see? So I was caught off guard. I was caught off guard because I said to myself, if I did have that occur for me, would I have done something of that nature? And I think the answer would be yes. And do you see it a lot?
We do. My practice is actually a combination of cosmetic surgery and reconstructive surgery, and throughout the years I have continued to perform breast reconstruction. And there have been incredible advances in technology, and one of the things that we are able to do today is genetic testing. And the gene that you're referring to is also known as the BRCA gene. And women who are carriers of the BRCA gene have a significantly higher likelihood of developing breast cancer during their life. Well, given the information of being positive for the gene allows a woman to take a proactive stance and decide whether or not she will proactively do something for the potential that she has of developing cancer down the road.
Right.
And many women do opt to undergo prophylactic or preventative bilateral mastectomies. And of course, it needs to be bilateral, removing both breasts, because we don't know which of the two breasts, or possibly even if both breasts are going to be involved when the cancer strikes. This is covered by insurance. This is proactive, this is preventative, but it is 100% covered by insurance. So many women choose to undergo a prophylactic or preventative mastectomy. Well, the defect that's created by that operation is potentially devastating.
Yeah.
And realistically, the breast is part of a woman's sexuality, it's part of her being. And to remove that will remove one of the essential parts of being a woman and of her own identity and being a person. So that what we're able to do for women who do opt for a prophylactic mastectomy is perform a reconstruction. And again, the reconstructions are covered by insurance, and there are some wonderful options that are currently available, and they all will create beautiful breasts, and we're able to achieve symmetry and natural results. Sometimes even we're able to achieve results that are even nicer than the breasts which were removed.
Sure.
So I find that prophylactic mastectomy with reconstruction is one of the very rewarding parts of my practice, in that we have women who are taking a proactive stance, they're doing something, and they are extremely satisfied with the outcome.
Yeah, I thought that was so courageous on her part, and I was so proud of her. And more importantly, I was proud that she was being open and verbalizing. And she was a stand for her commitment to her sister, her well-being, and to bringing this message out to the community, which was really pretty great. Tell me about statistics and some percentages, not like I want to get flogged down with all sorts of numbers, but the older that we get, and I happen to work with a large clientele base over the age of, I would say, 55, and like we discussed earlier about the graying of America and or the baby boomer getting older, my job is to have them not outlive their money, to have them live wonderful lives, to give them the confidence, the peace of mind, to be able to run and live and travel and eat and spend time with their children and grandchildren. But very often, as I've shared with many of my peers and clients, I don't think anybody should ever retire, because you can get bored, or you can get sick, or there's only so much golf and gardening you can do. And then ultimately what we have found based on statistics is people get bored or tired or depressed and possibly turn to drugs or gambling and alcohol. So I'm a big proponent of working. I'm not saying full time, but working and continuing to get dressed and feel good. So what is it that you see, and what is it you're telling people from, I guess, from an aesthetics perspective?
Well, I think what we're finding is that we are all leading very active lifestyles, and life doesn't stop at 65. It doesn't even stop at 72. But we continue to be active in either athletic endeavors or in family endeavors, and many times in professional endeavors. And those activities will take us well into our 70s or even 80s. And we're also, I think, finding that there's a tremendous amount of competition from a younger group. And as a result of that, many of us want to maintain a certain appearance about ourselves. We don't want to look like we're 20. We want to look natural, but we want to look like a very youthful age. We want to be able to manifest a sense of inner confidence and a sense of well-being, and the plastic surgery will help us to do that. we're finding statistically that over 10 million plastic surgery procedures are being performed a year. That is about 8 million non-surgical procedures and about 2 million surgical procedures. So as technology continues to improve, we are seeing a greater increase in the non-surgical interventions, the fillers and the Botox, which occupy probably about 50% of the non-surgical procedures.
Amazing.
It is amazing, actually.
Yeah.
When you consider that Botox was FDA approved in 2002, that's basically a track record of 8 years. It's now the most common non-surgical procedure that's performed in America today.
Do guys get Botox?
Absolutely.
Where would a guy like myself maybe get some Botox? On my face? Is that what Botox is primarily for?
Yes. Botox actually will temporarily interfere with muscles. And many times what we find is that muscle activity or muscle action is ingrained. So we develop these little frown lines here from the fact that we're constantly crunching small numbers or looking at a computer screen. Well, Botox will relax these muscles. Once these muscles are relaxed, the eyebrows open up a little bit, and it gives a much more open appearance to the eyes. Botox is wonderful. I love it.
So look at me now, and then look at me, I don't know, tomorrow. I'm not there yet. I have a question. So given that I work with an older clientele base, I would say 55 to 75-year-olds, is there a generation listening for your business?
Absolutely.
Tell me.
Absolutely.
Yeah.
Interestingly enough,
Yeah.
about 25% of individuals undergoing cosmetic procedures are within that age range. And in that age range, we're looking at primarily a facial rejuvenation. We're looking at eyelid lifts and facial tucks. And we're also looking to a large degree at improvement in body contouring. The love handles or the gynecomastia or breast enlargement in men, and of course just general body contouring in women. And I think that's related to the fact that we are, again, leading a more active lifestyle, that we are working out and exercising, and we are looking to look our best and to feel our best,
Right.
which plastic surgery helps us to do.
Helps, sure.
Absolutely.
Sure. And you're still passionate about this business.
Completely, and I think I'll be passionate for the next 20 or 30 years.
When does Beverly want to retire?
Never.
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 Got it. Got it. That's good. That's good. Yeah, you know, I'll watch TV or I'll be listening to people talk about how people are looked at, and they can spot someone automatically that they had some work done. Is that true?
No, absolutely not.
Tell more.
They can only spot the people who have had excessive amounts of work done. When cosmetic surgery is done properly, you cannot identify it. You cannot tell that Botox has been given or that fillers have been used. You can't tell a facelift, and you certainly can't tell a body contouring.
Right.
So when it's done by qualified, well-trained physicians, the results are very natural in appearance. Now, if someone came to me and said, I want to look plastic, could I do that? Absolutely.
Right.
Do people say that? Very, very rarely.
Right.
You know, I think the concept of extreme makeover is really a media concept, and it's not a reality concept.
Are you often fixing problems that maybe went bad?
Often, no. But do we have to correct problems? Sometimes we do. And I think it's part of the industry. Realistically, we're dealing with a human body. We're dealing with minutia and variations within the anatomy of each and every person that we deal with, so that we sometimes do have to tweak or correct issues that may be problematic or that a patient is just not completely satisfied with.
Right, right. Yeah, I appreciate this kind of conversation because, like I said earlier, when we're sitting down and we're talking about doing financial planning and retirement planning, very often I think we share this holistic perspective, which is you need to eat right, you need to drink enough fluids, and you need to exercise. And how you treat your body, your castle today, at the age of, say, 50, will clearly have an implication as to how the body is and reacts when it's 60, 70, and 80 years old.
That's very, very true. And that's one of the reasons why I incorporate the whole concept of age management into my practice. I think what we've found in today's environment is that kids spend an incredible amount of time on the computer, playing computer games, texting. I mean, they've got great thumb power, but you know, their muscle activity is markedly diminished. And I think it's very important that we get out there and we promote the concept of physical activity. And in much the same way as doing brain teasers stimulates the brain activity, so too even a modicum of exercise will stimulate the body and help to maintain a healthy condition.
You know, it's funny. I was with a peer of mine just over the weekend, and he was going to punish or take away his son's cell phone and his son's laptop. And he said in this punishment, "I'm taking this away from you, now go outside and play." Well, I started laughing because growing up as a kid, I didn't have a laptop, I didn't have a cell phone, and all I did was go outside and play. So it's interesting how times have changed, where we're now, as a punishment tool, and I'm using this as an example, that we're taking away technology and causing our children to go outside and play like it's something that like it's bad, like it's something that, okay, now you can't play with all this technological equipment that we bought for you to enjoy.
I think as kids get older, they'll realize what they missed in terms of their childhood and not being able to go out and play and not being able to have that personal interaction.
Sure.
And I think that we need to see a transition in terms of what we are encouraging our kids to do and what we're teaching them. But that's an issue for the educators and for the psychologists of today,
right,
and tomorrow.
And maybe even a different TV program. Do you have, we have like another minute left, and this like flew by, and I so thank you for sharing yourself
It's
with
been my
us.
pleasure.
Do you have a blog? Is there something, can we put, I'll list your website so that maybe if anybody wants to kind of find out some of your insight and some of your tips, they can sign on to your website and see some of the information. Please.
Well, my website is www.drbev.com, and that's actually spelled out DOCTORBEV.com.
Good.
And I do a blog on my website, so just scroll down to the blog and then click onto it, and you'll be able to read the latest and the greatest about cosmetic surgery.
I've seen it, and that's why I think it'd be very insightful for people just to kind of check it out. So I want to thank you for coming on the program. I appreciate your insight and your thoughts. And I always thank you, our viewers, for continuing to write in and to share with me what it is that's on your mind and what concerns you have, and if there is an opportunity for me to help address them in this type of a forum, I try to do that. If you want a copy of the program, feel free to give us a call at 1-888-SIMON-SAYS or reach out to the station that you're watching the show on, and continue to eat right, drink plenty of fluids, diet, exercise, and have a happy, healthy day. Thanks for tuning in.